Hi, and thank you for joining us. Today we're going to talk about the local delivery system called the Perio chip. What is Perio chip? Perio chip is a non-antibiotic, biodegradable, small gelatin-like piece that contains 2.5 milligrams of chlorhexidine gluconate. This chip is inserted into a periodontal pocket that is 4 to 5 millimeters or greater that cannot be reached with mechanical debridement. By placing this chip into the localized area, it will slowly release an antimicrobial agent over several days, arresting the bacteria colonizing in that area. Now let's talk about the procedure. After the localized area has been debrided, the area is dried and the chip is placed using tweezers all the way to the base of the pocket. The area is then protected using a periodontal pack and the patient will be given post-op instructions. Now let's talk about the mechanism of action of the perio chip. The molecules of the perio chip will bind to the negative microbial cell wall and this will alter the equilibrium of the cells. After these molecules bind to the cell wall, it will begin to inhibit plaque formation that is responsible for periodontal disease. The molecules will then bind to the salivary glycoproteins, and by doing this, it will reduce the opportunity of colonization and reduce the risk of periodontal disease progression.
Dislodgement of the perio chip is uncommon, but the client should inform the office if it does occur. If dislodgement occurs after 7 days, it should be considered the client got full treatment. If the dislodgement occurs within the first 48 hours, it can be replaced. If the dislodgement occurs 48 hours after, there should be no replacement, but a reevaluation should occur in 3 months' time.
The Perio chip acts as an adjunct for periodontal therapy after debridement. This improves patient outcomes, is a more comfortable option, and is a quick and easy chairside procedure. This reduces the need for systemic antibiotics and has fewer side effects. This is a great alternative for clients who refuse surgical treatment or where surgical treatment is contraindicated. Post-op instructions. No brushing or flossing in the area for 7 days with no dietary restrictions. Once the 7 days are complete, the client is to return to the office to remove the periodontal pack and reevaluate the area. It is recommended to administer treatment once every 3 months if pockets remain 5 millimeters or greater.
Contraindications: hypersensitivity to chlorhexidine, abscess present in the area, anaphylaxis, 18 years or younger, or pregnancy.
Possible side effects may include mild to moderate sensitivity post-operative, a toothache, a headache, possible staining in the area, or an allergic reaction ranging from mild to serious. Now let's answer some final questions. What is the active ingredient in Perio chip? If you said 2.5 milligrams, you are correct. Next question. The Perio chip is considered an antibiotic. If you said false, that is correct. I hope you enjoyed this educational video on the Perio chip, and thank you for watching.